Hello, and welcome to Nursing Experts Translating the Evidence. In this module, we will be discussing how to develop a concise statement. We will be using the PICO model to learn how to develop that important question to assist in our nursing practice. From Module 1, we learned about the evidence-based public health framework from Brownson. Here is a graphic that displays that process. If you notice, in Step 3, it is to develop a concise statement of the issue. This is where we are to ask a question. This initial statement of the issue, or asking the question, will then guide the literature search and the rest of the evidence-based process. PICO is a format that is used to write a good clinical question. The question needs to identify the patient, population, or problem that you intend to study, the intervention you plan to use, the comparison of one intervention to another if it is applicable, the outcome that you anticipate. PICO is a mnemonic used to describe the four elements. P stands for patient, population, or problem. This is where you want to identify who is your patient, population, or what is your problem. You may want to limit your population to a particular age group or other special subgroup. I represents intervention. Here you want to address what type of intervention you are trying to assess. Is it an educational intervention? Is it a preventative intervention, such as an immunization? Or is it a policy change? With the intervention, you should try to be as specific as possible. C represents comparison. Is there a control group that you are comparing? Or are you comparing your intervention with the gold standard of care? Sometimes your question may not have a comparison group, and that is okay. And O is for outcome. What do you hope to accomplish? So based on the information from the case study that was introduced in Module 1 and can also be found on the next website, we were introduced to a population that had a high STD rate among the youth and young adults and an active health department. One of many research-based PICO questions could be, among inner-city high school students, does STD prevention education delivered via social media decrease the likelihood of risky behaviors and increase STD screening rates? Inner-city high school students represents the population. The intervention is education delivered via social media. And outcome is decrease in risky behaviors and increase STD screening rates. In this question, there is not a comparison group. Once a well-structured question is formulated, then you are in a better position to search the literature for evidence. Personally, I have found that a good PICO question helps guide and organize the search process, and it saves you time by not getting distracted during the search of the literature. Let's practice identifying the different parts of the PICO question. Presented are titles from published research, and inside these titles, you can pick out the PICO question. Let's look at the first title. Can exercise increase fitness and reduce weight in patients with schizophrenia and depression? The population is the patients with schizophrenia and depression. The intervention is exercise. There is no comparison group. And the outcome is an increased fitness and decreased weight. The second title, Meeting Physical Activity Guidelines, is associated with reduced risk for cardiovascular disease in Black South African women, a 5.5-year follow-up study. What is the population? If you said Black South African women, then you are correct. What is the intervention? It is meeting the physical activity guidelines. And the outcome? Reducing the risk factors of cardiovascular disease. Again, there is no comparison group. The third title, Do soccer and Zumba exercise improve fitness and indicators of health among female hospital employees, a 12-week RCT. Population would be female hospital employees. The intervention is soccer and Zumba exercise. And the outcome that we want to measure would be improved fitness and indicators of health. Now this study has a time period which indicates a 12-week randomized control trial. So as a reminder of Bronson's framework of evidence-based public health practice, the first step is to conduct a community assessment. The second step is to quantify the issue, and the third step is to develop a concise statement of the issue. Here is an example from a fictitious community. The community data displays that there is persistent cervical infections associated with HPV. With research, we know that HPV is the most important risk factor for cervical cancer. We know, based on CDC data, that youth and young adults are at risk for contracting HPV. There are 3 HPV vaccines on the market that protect against HPV types 16 and 18 that cause most HPV cancers. And through health department data, we know that many preteens and teenagers are not receiving the vaccine. So based on the community that was just presented, what questions do you have for this community? Perhaps you were thinking about primary prevention and educating the population at risk about getting the vaccine for HPV. Perhaps you were thinking about educating parents in the importance of the vaccine. You may even be thinking about educating healthcare providers about talking to preteens and teenagers about obtaining the vaccine. Perhaps you were thinking about an intervention of having a mass clinic to administer the HPV vaccine or to conduct a STD screening program. Once you have your PICO question, you will want to write it down and move to the next step of the evidence-based public health process, which is determining what is known through the scientific literature. There are many forms and worksheets on the internet that will help you organize your search process. I recommend that you go to the Nursing Experts Translating the Evidence website to use the form that is displayed in this slide. Thank you for listening to this brief module on how to write a PICO question. Please continue on to the next module.